Go.
So here I am watching Ellie outside about 1 o'clock in the morning talking to a statue of a giraffe. She thought it was a little boy she was babysitting. Today I'm going to be telling you about dementia. It is a very prominent condition that will affect most of us in our lifetime, either ourselves or someone we love. Some forms of dementia are hereditary. This will include information on the 3 types of dementia, the symptoms related to it, and treatments for its diagnosis. Okay, so some types of dementia I will be telling you about are frontotemporal, vascular, and mixed dementia. Frontotemporal dementia got its name after many years of research from a doctor named Arnold Pick. In 1892, he was caring for some patients who he noticed had some changes in their mental status. He started calling it Pick's disease just to give a name to the condition. It has 3 main causes. One being nerve cell damage. This causes a loss of brain function, causing behavior problems and loss of muscle and motor functions. Behavior problems look like outbursts or yelling, agitation, like getting angry and possibly even violent. Muscle function is in the frontal lobe with reasoning that causes problems with speaking. Words get all jumbled up and with their thoughts, and it's hard to get sentences out in words that people can understand and make sense of. And here is a graph. The large part shows the Alzheimer's, the smaller blue is the frontotemporal, and purple is vascular. Another type of dementia is the vascular. This is caused by a few different things. According to the National Alzheimer's Research that was updated in 2011, strokes have a lot to do with the causes of dementia. If a person experiences many strokes, this affects how they behave. If you notice somebody is acting pretty confused all of a sudden, it is possible they have had a stroke or a lot of mini strokes. Blood flow blockage is also caused by these mini strokes. It causes the decline in thinking patterns because there is not enough oxygen getting to the brain. Inadequate blood flow to the brain eventually kills cells everywhere in the body. Hippocampus is where most of these cells are for learning, and it is in the center part of your brain. This is the signs of dementia. We have struggling to remember the dates or events, forgetting names of everyday objects, feeling anxious or getting angry because they forget. They get confused in familiar places, and their thinking and their reasoning is very difficult for them. Vascular brain changes often coexist with Alzheimer's, bringing us to the final type of dementia, which is mixed. Alzheimer's goes alongside severe depression. This is caused because it gets super frustrating forgetting small things. Like what you were getting up for, what you went into the room for, or who your friend is visiting you, dates and events. Protein deposits build up in the brain where damaged cells live that are caused from a stroke. Any blood vessel problems blood vessel problems don't allow blood to form properly, leading to blood clots, which in turn cause strokes. Again, the most common types of dementia are frontotemporal, vascular, and mixed dementia. Almost 800,000 people a year never get an official diagnosis. Treatment of dementia. As you get older, 3 things happen. The first is your memory goes, and I can't remember the other 2. There is not any miracle cure for dementia or Alzheimer's, but with a diagnosis, it can be better controlled with medications. These medications don't stop behaviors or eliminate confusion or make you be able to tell whether or not you went to the bathroom or need to still go. But it does help make these a little less severe. So when I found Ellie outside talking to the statue in the garden, I had to pretend I was seeing the same little boy play in the mud. But I reassured her that I would take over the babysitting responsibility so she could go in and get some sleep. Sometimes the only thing you can do is to go along with whatever is going on in their mind or with whatever they are seeing at that moment and pacify them with a solution to their problem. To correct them and to tell them this kind of thing is not really happening only agitates them and creates a lot more confusion. So now you can recognize some of the signs of dementia, or at the very least, Alzheimer's, in case you find your dear Aunt Sally outside talking to an inanimate object.